Hello, my name is Gerard from WCBF. I'm the Managing Director of the Process Improvement and Healthcare Division. I'm here with Gerard, Chief Learning Officer for Thedacare, who's one of our keynote speakers at the WCBF 11th Annual Lean Six Sigma and Process Improvement in Healthcare Summit here in New Orleans. Hi Roger, thank you for taking the time to talk to us today. The first question I'd like to ask you is, how do you prepare the Thedacare culture for readiness for Lean?
Thedacare cultural development started in 1991, and the whole process of learning at the leadership level and the manager level was a process of learning first how to improve quality, second how to improve financial performance, and third how to engage with people in that process. This was an in-depth training and development process that involved all of our leaders, all of our managers, for the better part of a decade around things like CQI, TQM, re-engineering, guest relations, and all of the fads that have come through the healthcare industry. Our concern over time, though, was that nothing stuck to the wall. Nothing stayed current. And because of that, we went to the Lean methodologies in 2002. But much of that work we did in the 90s was work that set the stage for what we then learned with Lean.
Roger, what do you do with the folks that don't align to your Lean methods?
When people don't align with what we're trying to accomplish as an organization, it shows up in a number of ways. It shows up in their performance. It shows up in their willingness to participate in a significant way in process improvement efforts. It shows up in some of the obvious behaviorals that come with attitude. And when those things occur, we have trained our managers to spend time with those employees, helping them understand more effectively.
Yes.
When that doesn't work, we sometimes have to have an honesty conversation with the employee.
Yes.
If this is not the organization for you, then perhaps some other organization is better, and we can help you find that organization.
Right.
We have a no layoff philosophy in our organization, but that doesn't mean that we accept poor performers.
Every year we conduct a survey with 6,700 hospitals in the US, and we ask them who are the top Lean deployers in the USA, and Thedacare always comes up in the top 5. Why is that?
I can't explain all of the whys in a brief interview.
Yeah.
But I will say that it starts with our cultural framework, the paradigms of work within Thedacare. Lean, Six Sigma, process improvement, all of these come with toolboxes. They all come with methods, tools, forms, mental processes to go through that are primarily rational processes. But in addition to that, we have to understand the organization as a social organization. It's where people come to interact with one another, to create relationships, to help one another. And in that framework, we've spent a great deal of time helping people access those relationships, build those relationships, and we've paid attention to the culture of the organization in addition to the rational processes. Right. That readiness causes people to understand in ways that just the logic does not.
Right, okay. Roger, how do you structure your operation to be effective as well as reducing costs?
Our framework starts with a triangle that has quality and safety at the top, business performance on the lower right, people engagement performance on the lower left, and the customer in the center. That triangle is emblematic of what we focus on whenever we make change. It's everywhere in the Thedacare documents. It's embedded in our process improvement reports. Right. And what we are communicating to all of our employees is that we're not trying to improve quality at the expense of the financials. We're not trying to improve the financials at the expense of engagement. We're not trying to improve any of this stuff at the expense of the customer. We need it all. We need quality improvement, financial improvement, engagement, and very satisfied customers in order to be a thriving business, and we need them all.
Roger, what are the biggest cultural changes of Lean implementation?
It's good enough.
Right.
That's the biggest one.
Right, okay.
And who gets to decide that it's good enough?
Yes.
Frankly, when we have studied the data in other organizations and we come from a position where what we have was thought to be good enough,
yes.
we oftentimes find that our good enough doesn't measure up to what other organizations in healthcare are doing.
Yes.
That becomes the beginning of our quest for trying to do something different to
right.
improve our data.
Right, right.
We learn a lot, both by going out and listening and learning from others,
yes.
but we also learn a lot by bringing others to Thedacare,
yes.
and they challenge our processes.
Right,
they
right.
challenge what we're doing, and we learn from that.
Okay. And what are the biggest challenges in healthcare right now?
Biggest challenges in healthcare right now would anchor around the same three corners of that triangle I just talked about. The consumers today want improved quality. They want to know that when they come to us, they're safe and that they're going to get high quality care. The second thing they want is they want care to be cost effective. Increasingly, the cost of health care is being paid by the consumer through co-pays and other charges.
Yes.
So they're very sensitive to price
yes.
and what they're paying for their care. Third, they want to know that the staff who are taking care of them, including the docs, care about them personally. And if they don't sense that, if they don't feel that,
yeah.
they're not going to want to come back to us.
Yes.
So all three of those dynamics around that triangle are
right.
at work in our building a culture of performance.
Right. Roger, how do you keep all the levels in your organization engaged in process improvement?
You can't. Thedacare is a complex organization.
Yes.
Thedacare has 6,000 people, including another maybe 800 to 1,000 providers
right.
across 45 campuses.
Okay.
And at any given time, we have high levels of engagement, or low levels of engagement, depending
yeah.
on what's going on somewhere in the system.
Right.
We have an annual employee engagement survey and a physician engagement survey that parallels that.
Yes.
And we have periodic 2 to 3 times a year pulse surveys. So we understand what the engagement levels of the organization are at any given time. All of that goes through the organizational development and HR staff, and I'm part of that staff. So we understand the engagement levels. We also have a steady flow of financial performance and quality performance data, and we've spent the better part of the last 4 years bringing the data from those 3 data sources into alignment with one another so that we can see how engagement, financial performance, and quality performance work together in the data charts. It's interesting. When engagement is down in a particular unit, actually their productivity scores are down as well, right. and so are their quality yes. scores. They work together.
Yes, yes, yes. Okay. How are you preparing for Obamacare?
We're learning.
Right.
We're staying briefed. The executive yes. team has had a number of full-day briefings on yes. payment reform.
Yes.
We understand the uncertainties that are going on within payment reform, and today what we're after is a robust understanding so that when things shake out, we're able to move rapidly.
Right.
Everyone today is hesitant to commit to much of a strategy around payment reform until right. things shake out.
Sure.
We're no different than anyone else.
Right, okay.
We do believe that our lean platform gives us the knowledge and the tools
yes.
to be able to respond rapidly once things happen.
Right, right, okay. No, that makes complete sense. Okay, now final question. Roger, what do you see the value of attending a conference like this?
This kind of conference provokes thought. I've said this several times since I've been here today. If the participants do not walk away with new ideas, new thoughts about their world, perhaps some paradigm shifts that need to occur in their institutions, then they're not listening well to what's going on. Fundamentally, traction follows action, and if you want traction on your change efforts, you have to take actions. This conference provides a very rich menu of possible actions that people can take when they go home. That is the only purpose for these conferences. Yes. Anything beyond that is academic yes. and non-pragmatic, yes. not useful.
Fantastic. Well, thank you very much for your time.
You're welcome.